How to get Suboxone treatment without insurance. Suboxone is a popular medication used to treat opioid use disorder, or OUD. It has saved and improved many lives of people suffering from opioid addiction. Unfortunately, Suboxone is expensive, and many people don't have insurance to cover the costs. That alone can be a barrier for many people who need this life-saving medication. We believe that everyone should be able to access Suboxone, no matter their financial situation. That's why this video will focus on how to get Suboxone treatment without insurance. In this video, we'll discuss what Suboxone is, how to get Suboxone treatment without insurance, how much it costs, and ways to reduce it. Suboxone is a combination of two medications used for OUD treatment. It contains buprenorphine and naloxone, which helps people manage withdrawal symptoms and cravings associated with addiction. Buprenorphine is an opioid partial agonist which binds to the same receptors in the brain as other opioids, such as heroin or oxycodone, but with a much lower risk of addiction and abuse. Naloxone, on the other hand, is an opioid antagonist that blocks opioid receptors and prevents the high associated with opioids. Suboxone has been approved by the FDA for OUD treatment since 2002 and is now one of the most commonly prescribed medications for opioid addiction treatment. Since Suboxone contains buprenorphine, it is a controlled substance and must be prescribed by a certified Suboxone doctor. You will need to visit your doctor or an opioid treatment program, OTP, to get a prescription for Suboxone. Not all doctors are authorized to prescribe buprenorphine products such as Suboxone. You may need to ask your doctor if they are certified to prescribe buprenorphine products or look for a provider trained specifically in using Suboxone. Now that we know how to get Suboxone, the next question is, how much does it cost? Several factors determine the cost of Suboxone. Let's look at these individual components that affect the total cost. The strength of the medication is a determining factor that affects the cost. Suboxone is available in 4 strengths: 2 mg buprenorphine and 0.5 mg naloxone, 4 mg buprenorphine and 1 mg naloxone, 8 mg buprenorphine and 2 mg naloxone, 12 mg buprenorphine and 3 mg naloxone. The higher the strength of the medication, the more expensive it will be. That is because higher strength medications require more active ingredients and a larger dosage. Suboxone is also available in 2 forms, strips and tablets. The cost between these 2 forms varies depending on your location. However, in many cases, strips are usually more expensive than tablets. The amount of Suboxone you need daily will also affect the cost. The more Suboxone you need, the more expensive it will be. Your Suboxone doctor will determine the dosage and frequency of your dose that is best suited for you. Suboxone is a brand name medication and is also available in generic form. The generic version of Suboxone, buprenorphine and naloxone, tends to be less expensive than the branded version. So if you want to save money, ask your Suboxone doctor if the generic version suits you. As you may already know, Suboxone comes in sublingual strips that can be dissolved in your mouth. The cost of Suboxone strips without insurance depends on the strength and quantity you need. Nowadays, a 14-day supply of Suboxone strips can cost anywhere from $60 to $250 without insurance. The lower end of the price range is for 2 mg and 0.5 mg strips, and the higher end is for 16 mg and 4 mg strips. So if your daily dose is 2 mg and 0.5 mg, a 30-day supply of Suboxone strips can cost you somewhere around $120 without insurance. Meanwhile, if your daily dose is 12 mg to 16 mg, a 30-day supply of Suboxone strips can cost you up to $600 without insurance. Suboxone tablets are cheaper than strip films. Depending on the strength and quantity you need, a 14-day supply of Suboxone tablets can cost anywhere from $42 to $100 without insurance. Each 2 mg by 0.5 mg tablet costs about $3 to $4, while each 8 mg by 2 mg tablet costs around $6 to $7. If your daily dose is around 12 mg to 16 mg, a 30-day supply of Suboxone tablets can cost you up to $360 without insurance. Suboxone prices can be quite high, especially if you don't have insurance coverage. Fortunately, there are ways to reduce the cost of Suboxone without insurance. Prescription savings cards are an excellent option for those without insurance who need to save money on their medications. Depending on the drug and pharmacy, These cards offer 10 to 85% discounts. They are made by pharmaceutical companies and/or their partners to provide discounts on certain medications. The way it works is that you can look up savings cards online and compare prices. Once you find a card that offers the best discounts, print it out and bring it to your local pharmacy when you pick up your medication. It's a fast and straightforward way to save money on Suboxone without insurance. Just check the terms and conditions of the savings card before you use it to ensure your prescription is covered. Patient assistance programs are designed to provide free or reduced cost medications to those who cannot afford them. Most pharmaceutical companies have these programs, and eligibility requirements vary depending on the company. The manufacturers of the medication also offer them, and you can usually apply for them online. The way it works is that you apply for the program, providing information such as your income and prescription needs. That is because patient assistance programs are reserved for those who cannot afford the medication and meet specific criteria. For example, two of the most common criteria for qualifying for a patient assistance program are 1. Having no health insurance, and 2. Having an FDA-approved indication for the drug. The application process can be lengthy, but if you're able to qualify, you can get free medications that will last for a year. Manufacturer coupons are discounts offered by the manufacturer of a product, including medications. These types of manufacturer coupons can be used at any pharmacy and can sometimes be used even if you have insurance. If you have no insurance and need to buy Suboxone, you can use a manufacturer coupon to get a discount. But to be eligible for these types of discounts, you must have a prescription from a certified Suboxone doctor and meet the criteria specified by Suboxone's manufacturer. You may need to disclose some personal and medical information to the manufacturer to be approved. Once approved, you can use the coupon at any pharmacy when you buy Suboxone. Remember that these coupons are not unlimited in terms of usage, so you will need to check the terms and conditions before redeeming them. Getting Suboxone without insurance can be difficult, primarily due to the high cost of the medication. But several options are available to those who don't have insurance and need this medication. Prescription savings cards, patient assistance programs, and manufacturer coupons are all viable options to reduce the cost of Suboxone without insurance. Before using any of these options, read the terms and conditions carefully to understand what is covered exactly. You should always speak to your Suboxone doctor before starting or stopping any medication. With that said, no one should suffer without the medication they need due to a lack of insurance. So explore every option you have and get the help you need. SuboxoneDoctor.com is the fastest way to find a certified Suboxone doctor that prescribes Suboxone with or without insurance. Visit our website today to find a Suboxone doctor near you and get started on your journey to recovery.